started, I guess, basically in 2012. She was diagnosed with Parkinson's. My wife decided that I couldn't take care of her. And that kind of hurt. But anyways, she decided to come to a nursing home. I'm usually here from 7 in the morning until 5 at night. So it helps me in helping Lois.
My husband was diagnosed with MS when he was 33 years old. He's now 70. So our whole life changed when he was diagnosed. He went into a wheelchair very early. Now he's a total quadriplegic. He's on a feeding tube. He's blind in one eye, losing the vision in his other eye for cataracts, but has a joy for life that you wouldn't believe. So.
The Ontario Caregiver organization exists to improve the lives of Ontario's estimated 4 million caregivers. And these are regular people who are taking care of family members, friends, and neighbors, often at home, but sometimes in hospital, long-term care, and other congregate settings. Caregivers told us that they want a consistent experience as a caregiver across healthcare settings. They want to be recognized. They want to be included. What we hear from our health system partners is that they're gaining great value from the Essential Care Partner Support Hub, benefiting from not only the resources that are available, but the coaching and support from the Ontario Caregiver organization team and their peers across the province.
Caregivers, care partners have always been a part of the care team, long before the pandemic, but in a very informal way. And so the pandemic allowed us to formalize our designated care partner program to demonstrate the value of having a designated care partner as part of the care team.
The Ontario Caregiver organization has created a repository of all of those best practices, the education that you will be providing. The coaching is really important, and that support, because they know that they've got people that they can reach out to who can help those organizations start a program and realize that I don't have to create my own.
I think it would be very important and very helpful to any facility that brought in the designated care program. As a designated caregiver, I was allowed in to support my husband emotionally, which benefited me as well emotionally because I was able to see him and know that he was okay.
One of the highlights of the training for me was having family members have an opportunity to share together, and they could hear each other's stories, which really helped to build relationship. And for those of us who were providing the training, it gave us an opportunity to observe and see where the supports were needed, to provide some support to family members and help them support their loved ones in a really meaningful way.
Nobody knows the patients or the residents like a family member. They help in activities of daily living at the bedside. They were there if the patient wanted to watch TV or turn the TV on, turn on or off the light, or close the blind if the sun was shining in their eyes. Those are small things that our staff would have been doing that a family member or an essential care partner was able to accomplish.
It's our belief that the implementation of essential care partner programs in hospitals and long-term care will make a positive difference for everyone involved: patients, residents, caregivers, and healthcare providers. We also know that these essential care partner programs actually are supported by evidence that this approach is in everyone's best interests for the best outcomes.
It's a win-win-win. Bringing family members and close contacts into a program as members of the team can only benefit.
I guess I still could have come in as a visitor, but to me, being the designated care partner is phenomenal.
It's a phenomenal program. It's been great for the hospital, great for the families. Absolutely recommend it.
I think having a formalized designated care partner program is the future of healthcare. All of us underestimated and undervalued the contribution of care partners until the pandemic shone a very stark light on what it's like when there are no care partners in the home. And it became very clear that a home isn't the community that we want it to be with them not here.